Nurse Aide Test Prep GRE. Question 1. When measuring intake and output, INO, the nurse aide should record. Option A. Only water the client drinks. Option B. All fluids consumed, including ice chips, soup, and gelatin. Option C. Only oral fluids. Option D. Only 4 fluids. The correct answer is option B. All fluids consumed, including ice chips, soup, and gelatin. Intake includes all liquids and foods that become liquid at room temperature, such as ice chips, soup, broth, gelatin, juice, milk, and water. Recording only water or oral fluids misses significant fluid sources. Question 2. A client with dementia frequently repeats the same question. The nurse aide should: Option A. Explain that they already answered the question. Option B. Answer the question patiently each time. Option C. Ignore the question. Option D. Write the answer on a whiteboard. The correct answer is option B. Answer the question patiently each time. Repetitive questioning in dementia clients is due to short-term memory loss. Answering patiently each time shows respect and reduces anxiety. Explaining that the question was already answered frustrates the client who cannot remember. Question 3. A client is having a seizure. The nurse aide should: Option A. Put a spoon in the client's mouth. Option B. Hold the client down to stop the seizure. Option C. Clear the area and turn the client to their side. Option D. Leave the client alone. The correct answer is option C. Clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration, and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 4. The nurse aide should wear identification. Option A. On their arm. Option B. On their upper chest at all times. Option C. On their back. Option D. Tucked in their pocket. The correct answer is option B. On their upper chest at all times. ID badges should be worn on the upper chest at all times for easy identification by clients, families, and other staff. Visible ID builds trust and meets safety standards. Question 5. A client's oxygen saturation reading on the pulse oximeter is 95%. This is: Option A. Below normal. Option B. Normal. Option C. Above normal. Option D. Requires immediate reporting. The correct answer is option B. Normal. Normal SpO2 is 95 to 100%. A reading of 95% is at the lower end of normal but is acceptable. Readings below 90% require immediate reporting. Question 6. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 7. The nurse aide's role in rehabilitation includes: Option A. Performing all ADLS for the client to save time. Option B. Encouraging the client to perform ADLS independently. Option C. Telling the client they cannot do anything. Option D. Leaving the client alone to figure it out. The correct answer is option B. Encouraging the client to perform ADLS independently. The nurse aide's role in rehabilitation is to encourage and assist clients in performing ADLS independently to restore or maintain function. Doing everything hinders progress. Question 8. A client with dementia has difficulty eating. The nurse aide should: Option A. Feed the client quickly to ensure adequate nutrition. Option B. Allow plenty of time and provide cues to eat. Option C. Puree all food to make it easier. Option D. Skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example, pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 9. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 10. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A, redirect the conversation to something more pleasant. Option B, provide active listening and allow the client to talk. Option C, tell the client not to worry. Option D, change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 11. When providing care for a client from a different culture, the nurse aide should: Option A, follow standard procedures regardless of culture. Option B, ask the client about their preferences and respect them. Option C, assume cultural preferences based on the client's appearance. Option D, ask the nurse to provide care instead. The correct answer is option B. Ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 12. The best way to communicate with an unresponsive client is to: Option A, avoid talking to them since they can't hear. Option B, speak to them as if they can hear and respond. Option C, speak loudly near their ears. Option D, only speak to family members. The correct answer is option B. Speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 13. Which task is outside the nurse aide's scope of practice? Option A, applying a gait belt. Option B, recording output. Option C, changing a sterile dressing. Option D, offering a bedpan. The correct answer is option C, changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 14. What is the correct way to transfer a client from bed to chair? Option A, pull the client by their arms. Option B, use a transfer belt and proper body mechanics. Option C, lift the client under the armpits. Option D, have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 15. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 16. When a client is being discharged, the nurse aide should: Option A, assist with packing and ensure the client has their belongings. Option B, tell the client to call if they need help. Option C, let the client pack alone. Option D, rush the client to leave. The correct answer is option A. Assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 17. The nurse aide's responsibility with advanced directives includes: Option A, helping the client complete advanced directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advanced directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advanced directives and inform the nurse of any issues. The aide does not assist in completing advanced directives, make decisions for the client, or explain legal documents to the family. Question 18. An adult client with a respiratory rate of 8 breaths per minute is experiencing: Option A, tachypnea. Option B, bradypnea. Option C, normal breathing. Option D, hyperventilation. The correct answer is option B, bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 19. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B, provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 20. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 21. Normal adult respiratory rate is: Option A, 8 to 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 16 to 24 breaths per minute. Option D, 20 to 28 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 22. Which activity is most appropriate for a client with dementia? Option A, complex puzzles. Option B, simple folding tasks. Option C, reading medical journals. Option D, watching educational films. The correct answer is option B, simple folding tasks. Simple, repetitive tasks like folding towels provide a sense of purpose and are appropriate for clients with dementia. Complex puzzles in medical journals are too challenging. Watching educational films may not be engaging. Question 23. When performing passive RUM exercises, the nurse aide should: Option A, have the client perform the movement independently. Option B, move the client's joint through its full range of motion. Option C, force the joint beyond its range. Option D, perform RUM exercises only once a week. The correct answer is option B, move the client's joint through its full range of motion. Passive RUM involves the nurse aide moving the client's joint through its full, pain-free range of motion. The client does not participate actively. Forcing beyond the range can cause injury. Question 24. When counting respirations, the nurse aide should: Option A, tell the client they are counting breaths. Option B, count while appearing to take the pulse. Option C, count for 10 seconds and multiply by 6. Option D, count for 30 seconds and multiply by 2. The correct answer is option B, count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 25. A client with a history of COPD should have a target SpO2 of Option A, 100%, Option B, 94 to 98%, Option C, 88 to 92%, Option D, 85 to 88%. The correct answer is option C, 88 to 92%. For clients with COPD and chronic hypercapnia, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia. The target for healthy clients is 94 to 98%.